Welcome to Osteoporosis and Exercise. In Module 1, we'll cover symptoms, background information, and risk factors. Then in Module 2, we'll look at screening and treatment. And then we'll finish up with Module 3, looking at exercise issues for people with osteoporosis. It's really only been in the last 20 years or so that osteoporosis has been talked about in the public domain. Most people know it as the brittle bone disease, and osteoporosis does literally mean porous bones. It's a progressive condition when the density and therefore the strength of bones is reduced, resulting in an increased risk of fractures occurring. The statistics worldwide are pretty alarming, and they're only going to get worse as our population ages. 1 in 3 women and 1 in 5 men globally after the age of 50 will suffer a fracture of some sort. And in the UK and New Zealand, they actually predict 1 in 2 women. So it really is a huge concern, as the treatment of fractures does cost billions and billions of healthcare dollars or pounds, not to mention the emotional, physical and economical toll that it takes on the individuals for whom this applies. It's known as the silent disease, as in many cases there may be no obvious symptoms or warning signs until late in the condition when a bone fracture occurs. Sometimes in what is seemingly a very minor trauma, something like a sneeze or an awkward lift or twist of something quite light can result in a fracture. The spinal kyphosis, or the dowager's or widow's hump that you see on some older people, may be an indication, or significant loss of height may also be an early sign. But the great majority of individuals, as you can see from the slide there, are actually never identified or treated, even though they've had one osteoporotic fracture. So what do we need to know about our bones? Well, we tend to think of the skeleton as an inert set of bones that hold us up and doesn't do much else, but that's very far from the truth. It's every bit as dynamic as other tissues. Bone responds to the pull of muscles and gravity, repairs itself, and constantly renews itself. When bone is broken down, it's called resorption, and when it's rebuilt, it's called formation, and this whole process is known as remodeling. Osteoclasts are the cells that break down old or damaged bone, while the osteoblasts fill in the cavities left by the removal of this old bone. Both the cortex, or the cortical bone, which is the outer shell-like part of the bone, and the trabecular bone, or inner, more spongy type bone, will be compromised when there's a lot of breaking down going on and not a lot of rebuilding. We spend the first 20 or so years building up our peak bone mass. Girls peak in their early 20s and boys a little bit later. We maintain this for about a decade or so, and then peak bone mass starts to decline, with a significant decline for women after the menopause. Once women reach menopause, we see a rapid decrease in bone density. This is due to losing the protective factor of estrogen. It also applies equally to women who have had a hysterectomy and therefore experience early menopause. Women therefore lose bone density 2 to 4 times faster after menopause. So for some women, half of their skeletal mass has been reduced by the age of 65. This equates to 1 to 2% of spinal bone density per year, but for some women it's actually even more rapid than that, nearer 3 to 5%. So what does having low bone mass really mean? Well, it means you're at a greater risk of suffering a fragility fracture. And the most common sites for these to occur are in the spine, namely the thoracic spine. According to quite a well-known study back in 1984 by Sinecki and Mickelson, T7, T8 and T6, i.e. the spinal bones just between the shoulder blades, are in that order the ones most prone to fracture. That's because the vertebral bodies get smaller as you move up the vertebral column, and also because the thoracic vertebral body's orientation towards flexion loads up the spine anteriorly. The other sites where fractures are common are the hip and the wrist, which makes sense. Quite often the wrist is put out to break a fall, and due to having brittle bones that would break, or in the arm and the humerus bone most commonly. So how common is this condition? Well, according to the IOF, it's very serious indeed. 75 million people across Europe, US and Japan suffer from osteoporosis, and this is due to double within 50 years. In addition, you've got another 225 million people in those countries who are classified as osteopenic. And this is not unlike the situation we have with diabetes, where we do have enormous numbers of people who are diabetic, but then we've got a tsunami of people who are pre-diabetic waiting in the wings, as it were. So between osteopenic and pre-diabetes, we've got an epidemic of some of these issues coming through. It's a bit difficult to relate to those huge numbers, but we can certainly relate to the next one. 1 in 2 women, as I've already mentioned, and 1 in 4 or 5 men over the age of 50 will suffer a fracture in their remaining lifetimes. And to put it in context, a New Zealander will break a bone due to osteoporosis approximately every 5 minutes, and New Zealand does not have a very large population. The link between sunlight and therefore vitamin D manufacture and bone health is very clear when we see that osteoporosis is more prevalent the further we go from the equator. So in New Zealand, for example, rates of osteoporosis are higher in Southland than they are in the north of the country, and very similar in the UK. Scotland have higher rates, for example, than the south of England. So what are the risk factors involved in developing this condition? Some are clearly non-modifiable, things like age, sex, family history, and ethnicity. The darker skinned races like Maori and Pacific Islanders and Africans have much better bone density than Caucasians or Europeans, for example. On the right-hand side, you'll see the list there of modifiable risk factors. Smoking, leading an inactive or sedentary lifestyle, not getting sufficient calcium-rich foods in your diet, and not having that important exposure to sunlight to produce vitamin D. This could be because of where you live in the world, as we've already mentioned, or it might be that for religious purposes, you don't expose your skin to sunlight, or perhaps you can't get outside to absorb that vitamin D. As you may be aware, vitamin D can't be absorbed through glass or if you've applied sun factor. Alcohol intake or excessive alcohol intake will not do your bones any favour. And drugs like the corticosteroids, most notably prednisone, is also linked with an increased risk factor of creating brittleness in your bones. Corticosteroids or prednisone is prescribed for all manner of things, from skin conditions such as acne and eczema to respiratory problems to rheumatoid arthritis. Another class of drugs known as the protein pump inhibiting drugs, which are again prescribed for quite commonly for reflux and other types of ulcers because they reduce acid in the body. They're also linked with increased risk of developing osteoporosis. Low body weight or having small bones and being underweight also carry an increased risk. And of course, as we've already discussed, that drop in estrogen that occurs after menopause is a key factor or a key risk factor in developing osteoporosis. It seems there's a correlation between diabetes and increased bone fragility or the risk of osteoporosis. And this holds true for type 1 diabetics more than type 2. This makes sense as during those formative bone forming years of adolescence is when most type 1 diabetics are diagnosed. And at that stage, there's a lot of things going on hormonally. Notably, insulin is compromised. And as insulin is a growth hormone and contributes to bone growth, it means that a type 1 diabetic starts with less in their bone bank. This is a good time to talk about the bone bank concept as it relates to youngsters, particularly young girls. The idea is that you lay good foundations early on so that you have as high a peak bone mass as possible. The idea is to invest in good bone building practices like impact exercise, good calcium intake, good vitamin D production, and avoid all the things that we know won't help good bone health, like smoking or taking drugs on a long-term basis. The idea, of course, is that prevention is better than cure. that once you get to your peak bone mass in your early 20s, you've got a good amount of deposit, if you like, in your bone bank. So to summarize what you're trying to do in terms of your bone health through the ages, it's as a youngster, you build your bone mass. As an adult, you maintain it. And when you get a little bit older and perhaps into the elderly category, you just want to prevent further loss.